Thank you and welcome everyone for this important session. This session is about how they're driving the digital health. Now, local teams are critical in ensuring that digital health finds roots in countries, in deploying information systems, in deploying products, as well as in making them sustainable and scaled up. There are also the groups or the teams that local governments are comfortable working with, as opposed to technical expertise that come in and go. Local teams have a big role to play in supporting digital health. And this morning, today, we have a lineup of experts who represent regional and national health informatics associations and global goods groups. And they will be talking to us on how these organizations and associations are making digital health work for everyone. And I will introduce them one by one. So my name is Sam Mwambugu, and I'll be moderating this session. Our first panelist is Dr. Alvin Marcelo from the Philippines. Dr. Marcelo is a general and trauma surgeon. He is the executive director of the Asian eHealth Information Network. And prior to this role, he served as the senior vice president and chief information officer of the Philippine Health Insurance Corporation. As the director of the University of the Philippines Manila National Telehealth Center and chief of the Medical Informatics Unit, Dr. Marcelo established the Master of Science in Health Informatics program. He is the Philippines representative to the Asian Pacific Association for Medical Informatics and the Medical Informatics Association, also known as EMIA. Next, we will hear from Dr. Tom Oluoch from the US, representing the HELINA organization. Dr. Oluoch is a health systems expert with an interest in designing, implementing, and evaluating large-scale digital health solutions in low-income settings. He has led implementation of patient-centered, interoperable digital health projects across more than a dozen African countries. And he has also served on various global and regional technical advisory groups and task forces for WHO and Africa CDC, working on capacity development and health information exchange policies and standards. As I said earlier, today he's here wearing the hat of the president of the Health Informatics in Africa, also called HELINA, and he's also the founding chairman of the Kenya Health Informatics Association. From the Caribbean, Danielle Marlings will be speaking to us. Danielle serves as the Caribbean and the Americas representative on the Young Experts Technical Tech for Health Council, and she's also the president of the Faculty of Science and Technology Guild Committee at the University of the West Indies, Mona. She's said to be one of the field's brightest young minds, and Danielle believes strongly in the power of tech and innovation in edifying society. With a natural affinity for leadership and youth empowerment, Danielle represents the voice of young people in technology, education, national issues, and tech for health. Our fourth speaker will be from Kenya, Steve Wanye. Steve is a digital health specialist with over 20 years experience in architecting, developing, deploying, supporting, maintaining, and using digital health solutions across the board, from personal health records to health management information systems in a health enterprise. Steve is founder and chief executive officer of IntelliSoft Consulting Limited. Today, he's here because he's the secretary of HELINA and Kenya Health Informatics Association, and he also sits at the board of Safaricom Health Advisory Board. Steve is an active member of multiple global health communities, including the Health Data Collaborative and also Interoperability Working Group. Our fifth speaker is Carl Fori from South Africa, and Carl is the Deputy Director of Global Goods at Digital Square. and has keen interest in ongoing development and implementation of digital solutions to impact health. He has a background in technology and a focus on information exchange and open source tooling. And Carl is passionate about seeing products become stronger in terms of implementation and impact. And Carl is excited to engage in looking at how groups of products and companies build sustainable business models for open source technologies. Now we'll go straight to Dr. Alvin with the first question. So Alvin, how is EHIN, the association that you present, making digital health work for everyone in your region?
Good morning, good afternoon, and good evening to everyone. So AHIN is the acronym for Asia eHealth Information Network, and we were created by the World Health Organization in 2011. We started out as representatives from ministries of health and academe and non-government sector, and we all share the same problem. How do we get all of the data that the government was getting into one integrated system that could be used for timely and accurate decision making? That was 2011. And we thought that we all were in the same boat. We all had the same problem, and we could share stories of how each of us in the region, in the Asian region, try to solve some parts of the problem. And hopefully, if we all formed a learning network amongst ourselves, we would put together all of our knowledge and avoid some of the mistakes that some of us have committed, and also help our other friends to go towards a specific direction when they start building their health information systems. And so after 9 years, we summarized our approach as what we call the Mind the Gaps approach, which is we think to get digital health accessible to everyone, there should be a clear governance structure, a clear enterprise architecture, good program management for P, and standards for interoperability for S. So the Mind the Gaps is our contribution to assisting countries in making sure that digital health is available to everyone. Mind the gaps. Sam.
Thank you, Alvin. Dr. Tom Oluoch, would you say the same is happening in the African region through Helena?
Good evening, everyone. So similar to what Alvin said, I mean, Africa faces very similar and sometimes very unique challenges in terms of use of data to inform clinical practice, to inform policy, and so on. And there's a huge gap. And Africa also has these unique challenges in infrastructure and just having kind of coherent plans, e-health strategies that can help lead to achieving health goals. So with those same challenges, I mean, there's need to identify neutral bodies that bring together people from academia, from research, from implementation groups, and even the funding communities to come together with a common goal to define, policies and ways of moving digital health forward. And so Helena is, as was mentioned earlier, an African body that brings on health informatics. And currently we have about 12 member national societies. So through these national societies, we're able to interact with governments, we're able to interact with those in academia and research to be able to define clear digital health goals. And we are kind of broken down into three broad groups. One is the education working group, which focuses more on capacity development for digital health. And the second one is on standards and interoperability, which promotes use of open standards for health information exchange. And then the third working group is on data analytics and big data, which focuses really on using kind of the latest advanced methods of data and mining data out of large data sets to make meaning out of that data and to promote data use to inform policy and to inform practice. So yeah, that's how we're engaging with communities to promote the use of data to improve healthcare in Africa.
Thank you. Thank you. I'll now turn to Danielle. Danielle, can you tell us the status of Caribbean and the Americas in ensuring that digital health is working for everyone, and particularly touch on the issue of the youth involvement?
Sure. So I am the Caribbean and Americas representative for the Young Experts Tech for Health, which is basically a youth council. And I want to speak really quickly to what the Young Experts are. And essentially, it's an independent council that provides insight to the Transform Health Coalition for Universal Health Coverage in 2030. And really and truly, it's a very diverse group, a very diverse body, because we have young persons represented from all 6 WHO regions. And, if you keep up with the statistics, like what there are people in the world that are between the ages of 15 to 24. And when you look at that growing population, it becomes increasingly important for us all to ask ourselves, how do we meaningfully engage young persons as we move into this digital era, and we're moving into the digital health era? How do we meaningfully engage young persons? And so I love the model that Transform Health uses. As someone from the Caribbean, I get to be informing and assisting in the various working circles of Transform Health, such as I work on the resource and investment circle as a co-chair, right? And so as someone from the Caribbean, I can bring that diverse perspective and background to the table and ensure that as we're building out all these different strategies, not only the Caribbean, but Caribbean youth are being included in this movement. So definitely Transform Health and the Young Expert in Tech for Health has been, creating campaigns, creating initiatives. And the last thing we've worked on now is our own, roadmap for how we think the campaigns can be structured in order to effectively include young people from across the world.
Thank you. So we've heard from representatives of regional associations. Now let's hear from an in-country association. This is Kenya Health Informatics Association. Steve, is the Kenya Health Informatics Association getting a seat at the table in getting digital health entrenched and scaled up in Kenya?
Thank you very much, Sam, and good morning, everyone. Absolutely, Sam. Kenya, in short, as we call it, has been around for the last 10 years. And through these 10 years, we definitely kept getting a seat at the table increasingly. As you can imagine, initially it wasn't easy just because we're not quite understood. But I think over existence over those 10 years plus, I think the rest of the stakeholders, particularly government, through Ministry of Health, Ministry of ICT, and the rest of government in Kenya, they've actually come to realize and acknowledge and really see the value that Kenya, the Kenya Health Informatics Association brings to the informatics space in Kenya. Besides, I would say, practice and application of informatics, we've also gotten a seat at the table in discussions with pre-service institutions, basically all these organizations and institutions that are training future informaticians, where our opinions have been sought, our contribution has been sought to basically help enhance and contribute towards curriculum, and beyond that, even actually support actual delivery of the curriculum. So we are seeing we're seeing a really good development and a very good trajectory in terms of our increasingly a clear role in the broader space, which was not the case before. And we're really excited to continue this journey. And I think beyond for example, country, we're also seeing a lot of appreciation beyond Kenya, working with regional organizations and also international organizations. Thank you, Sam.
Thank you, Steve. Now, the other question is on global goods. What are they, and what role do they play in ensuring a scaled up digital health, one that leaves no one behind? And I'd like to ask Carl to speak on the global goods and whether or not they are stifling local innovations or whether they are part and parcel of local innovations. Steve, what would you say about that from your position in the digital square?
Hi, thank you, Sam, and thank you to the panelists before me. What a privilege to be on this conversation, standing next to these shoulders and these giants here. That's a fantastic question. And really just to take a moment from looking at the concept of global goods. This is not a new concept in the economic space, really, but we're focusing it here at the space of digital health tools. And while we're starting with it, we know that other groups such as the WHO and UNICEF are taking it even larger than what we're looking at it. So in our world of Digital Square, the concept of a global good is three-part, really framed around any technology that has a zero cost to entry, so an open source tool, or a service that is available without cost, or content that is available to be leveraged in a particular space. And these are solutions that are evident at scale and are evident to be making impact in the space of digital health at this point. So to your question of whether we see this as a potential stifler or an enabler for a local capacity, I think that's a fantastic question that gets right to the sharpness of what does it mean to be a global good and why do they exist? How have they come to be? So by the nature and the definition of these, a global good is something that has been upwardly filtered by implementation and use in country and particular settings. These are not set by a council, so to say, but they've really come up in terms of countries saying we're leaning on these particular technologies to solve problems. And we've chosen these because they've met our needs or they've been able to be adapted to meet our needs itself. That not at all excludes new technologies from coming into the space. And in fact, excitingly, as we as Digital Square are trying to facilitate these innovators and align funding opportunities to it, we've seen a range of new global goods coming up and into the market space where technologies are saying we're being used at scale. We fulfill these criteria. And in fact, we've been driven from country opportunities and developed by country teams. So to come around to the other side of it is, well, how does this all play out when we look at a concept of local capacity building and what does it mean for local teams? So we as Digital Square work very much to try foster these groups who are building these technologies, services, or content, as well as aligning with countries and the different donors and investors in this field to really bring together the concept of bringing the capacity to where the situation and solution needs to be housed and implemented. So for what we're seeing as an exciting opportunity is that global goods provide a stepping stone for local innovators to build on top of, to implement, and to link into a broader community that is very willing to start sharing knowledge and information, as well as good patterns and design and learn from different countries and new implementers in the field.
Alvin, one of the audience members is asking a question that the development of digital health has its own challenges, and some of the countries are lagging behind the others. We also know that there is a gap between, the development of digital health in cities as well as, different from rural areas. Youth and other groups, there are differences there. So how is Ehin and also your experience working in this field for a long time think that we can bridge those gaps that currently exist?
Thank you, Sam. Over the past 9 years, the Asia eHealth Information Network members, most of whom come from the ministries of health themselves, who are the focal points of digital health in their own countries, have succumbed to the 3 C's. The first C is complexity. There's just too many stakeholders and players and people who are in the health system and technologies adding to the digital health complexity. And the second C was compliance. In Asia, privacy is becoming more known concept, and so compliance to privacy and security have increased. The third C is cost. These digital health systems are very expensive, and government has realized that there needs to be substantial investments that need to be made. So complexity, compliance, and cost are the current challenges that our members are facing right now. And so our advice to them, and this is an advice together that was created by all of us together, putting our heads together, is that we should have, number one, a clear governance structure, a multi-sectoral group of people who are accountable in making important decisions for digital health in the country. And this is led by the Ministry of Health. The Minister of Health is the lead of this multi-sector group. That is our first G, governance. And then the governance structure, one of the first things they need to do after giving the directions or the strategy for digital health is to have a shared enterprise architecture or a blueprint that all the stakeholders should be able to understand and should be able to implement based on the blueprint that has been given to them by the governance structure. And then we need to have good program management so that the stakeholders are able to build their part assigned to them in that enterprise architecture or the blueprint. And the standards, of course, will follow the blueprint. As long as you have standardized building blocks in your blueprint, then the stakeholders will be able to build interoperable systems. So we think that if the good governance structures are in place, all the stakeholders will now know where to go to, ask questions, and get resources. So I hope that that's something that we can also learn from. Some countries in Asia have started to implement the Mind the Gaps approach. Some are just about to start. And we're gathering their own experiences implementing the Mind the Gaps framework. Thank you.
Alvin. Tom, Alvin, has raised an important issue there of complexity, compliance, and cost in, scaling up digital health. Would you say that, health of associations are the place to go to break this complexity, especially bringing together the universities, civil society, and the government and other stakeholders? Is that the way to go?
With many of the issues that Alvin has raised on the Asian region. Same with them, many of them apply in the African sector in terms of high cost of implementing digital solutions, and then just lack of human capacity, adequate human capacity with expertise to build those complex solutions in a way that they can be reused and in a way that they can be sustained. So, and this is where we see the role of local organizations, especially, like I mentioned earlier, they bring in expertise from different fields, from academia with a theoretical background, and guests from industry, and even the funding organizations, like I mentioned earlier. And just some of the things we also experience as challenges in the policy area, where sometimes there's inadequate policies to regulate the digital health solutions, which is a relatively new thing in many African countries, and just being sure that things like open standards are applied to ensure reuse of systems. And that's why at Helena, many of our countries, we are glad to say, are adopting open standards and use of kind of open source solutions to ensure the costs are brought down and that they can be reused and they can be sustained. It's beyond routine funding by governments. And one thing I didn't mention that I think is important is just our Helena's close working relationship with the Africa CDC. And Africa CDC is part of the Africa Union that's mandated to support public health emergency response through routine surveillance by building capacity in epidemiology, in lab sciences, and in public health informatics. So through capacity building in the various, helping develop policies that inform the work in those member countries, we can help to promote best practice of use of open standards, overall bring down cost and improve the literacy, the computer literacy levels, and use of data for policy and for public health emergencies.
Steve, one of the questions we've received from the listeners is that is asking, what are the shortcomings of open source? And the question about the open source is in terms of the shortcomings in implementation and financial costs and overall costs of maintaining open source solutions. I know you're passionate about open source solutions. What would you like to say regarding those kind of implementation challenges and also the financial challenges for open source solutions?
Thanks a lot, Sam. Yeah, you're right. I'm definitely very passionate about open source. I think just going back to some points that Carl mentioned earlier, if you connect that with sort of the rapidly emerging global community on digital public goods, I think people need to understand open source beyond the technology itself. Of course, technology is really the heart of it, but I think once you extrapolate all that and you start thinking about what else comprises of this open source product or service that actually makes it really, really great, then I think you really start to appreciate what it offers to you. But I think, and the arguments for open source obviously are many, and there's very strong evidence towards why open source is good, including very recent evidence about, for example, an open source like OpenMRS, they were able to cost it and say, it costed so many millions of dollars over the last so many years to build it and actually get it to where it is currently. But that notwithstanding, I think it's very easy for people to confuse open source with free. I think we all know nothing is really free in this world. And, just taking an example of myself, we use open source all the time, to provide services to our clients. And there are some very clear costs that come along with open source. You obviously have a lot of savings, but one of the costs that I think people don't really appreciate and realize is really the capacity cost, particularly in terms of human capacity. A lot of the open source solutions or products are really, really cutting edge, very well thought out, in my opinion, and built out products. But they equally require people who are dedicated, committed, and actually qualified to be able to use them to solve specific problems, but also support the clients who are using them to actually improve their business processes and solve very specific challenges. I think that's one of the areas that has not been very well understood. So while you're making savings, but there are also certain costs that you really can't avoid, and actually you really shouldn't even try to avoid, and you should deliberately invest in those. But yeah, I would say financially, there's lots of savings. I think it's very clear, savings such as licenses, licenses to use those products. Those are huge savings that you actually make with open source. There's a cost also that are probably a little bit indirect, but cost of having someone to actually consult, someone who knows better than you within the community of open source that you're able to consult, which otherwise you'd be paying for it, at a very high fee. So those are also costs that you can deliberately see how you're reducing them significantly, or even sometimes completely eliminating them. That's what I would say for now, Sam. Thank you.
Thank you, Steve. Carl, what's your take on the same question on the challenges and benefits of using open source and their sustainability and scale up? Given some of those open source solutions fit within the definition of global goods.
Thank you, Sam, and thank you, Steve, for setting the table, so to say, on this space. I think the topic of open source has become so polarized that it's really lost a lot that needs to be looked at in it. You tend to end up with two camps, like open source for everything and not open source. And I think that's a naive way to think about it in our modern day and age, especially when we start looking at mixed models of serving health systems. I think it's important for us as architects, implementers, and decision makers to always keep front and center of mind that it's the people that we're serving. And we have to do that to the best of our abilities. And to bring that in, I think the point of open source that I've often found so liberating is the possibility of choice. That implies that your decision makers have the choice of where they want to place their investments. And that's not to say that's excluded from proprietary areas. Each health information system implementation is actually part of a much bigger digital health intervention. And those costs are always there, whether your license is open source or proprietary in terms of purchasing or even software as a service. Each of these aspects need to be thought about. And Steve brought up a fantastic point that there is a way of bringing your license costs down, but that needs to be paired with the capacity you need to maintain the tool. And that's where I think the decisions need to be made, is less on the it's free or not, more on the overall total cost of the opportunity and what comes in with it. So there is an unashamed plug for a later session where there is the hidden cost of free, where we dive into a few of these topics. But in the general space, I think today we're starting to see a lot more around open architectures and data standards, and that really empowers your architects and decision makers to understand where different technologies and solutions will plug into an overall architecture. And so Elvin alluded to an enterprise architecture and mentioned that as some of the work going on in AHIN. I think that's really a base pattern when we consider where open source fits in and what the total cost of ownership of any solution, open, hosted, or proprietary, would need to sit.
Thank you, Carl. Yeah, Danielle, without private sector, digital health is unlikely to scale up, to flourish. Would you agree with that statement? And how is your organization bringing in the private sector to be important stakeholders in the digital health space?
Okay, thank you for that question, Sam. Definitely. The model that Transform Health is using is basically focusing on the importance of campaigning and advocacy, basically in trying to create not only willpower in terms of political willpower and buy-in, but also from the private sector as well. If you're not able as a global community to create a solid case for why digital health is necessary, why it's necessary for all sectors of the population, and why it's necessary that we build it in such a way that it is suited for all sectors of our population, then you won't be able to get that buy-in that will create a sustainable digital health platform that will last over a period of time. So I definitely think that on a local level in different countries across the world, we do have to encourage private sector buy-in, because without that, funding, one, and two, without that just general buy-in from the private sector, plus from government agencies, as well as from the persons who will be utilizing the system in the first place, right? You speak about user acceptance. If you don't have buy-in at all levels, it will be very difficult for any system to be sustainable over a period of time. So definitely.
Thank you. Alvin, this question comes to you. It has been asked by a member of the audience, is asking, in terms of shared enterprise architecture, do you see a role for low-cost software as a service rather than customized development of software? And the part B of that question is whether can interoperability between local systems and software as a service platform be a solution?
Thank you, Sam. So the question is actually a technical question where the answer will depend on whether there's a shared blueprint in the first place. So the shared blueprint that would be given out by the governance structure would then be the reference point in answering that question. Because in fact, the answer could be a yes, if the software as a service is part of the shared enterprise architecture coming from the governance structure. But if it is not in the shared enterprise architecture, then software as a service will not be a part of the solution. So I would rather that we go take the steps back, 2 steps back, look at the blueprint first before adopting the technology. Because in the end, if we go straight to adopting the technology, and the technology was not referencing the blueprint, then the chances of having fragmented, siloed systems is going to be very high because they were never part of the enterprise architecture interoperable blueprint in the first place. However, I think software as a service has a part to play in an enterprise architecture, but I don't want to preempt the process, and I want the governance structure. This could be the Ministry of Health together with the Ministry of ICT, together with the National Health Insurance Agency, together with the Ministry of Finance, just coming together as a governance structure and telling us, guys, this is our enterprise architecture. Please read it, ask us questions, give us comments, give your suggestions. If you can see yourself in the blueprint, please start building and making commitments that you will build that part of the blueprint. And if it's software as a service, tell us why you think it is software as a service. And if we think it is, in fact, a software as a service is compliant to the architecture, then we will give you the go signal. We might even invest on you. We might even take you in as a consultant for the government. But going straight to the technology without the blueprint, I think, is going to be very problematic.
Yeah, thank you. The next question is open to any of you if you'd like to take it and answer. The role of local teams and regional and national associations in governance of digital health. How do you see your associations and organizations playing a role in the governance of digital health?
Hi, Sam. Let me try to jump in first. And I'll just talk on as Helena. And I'll just follow through some of the things that I mentioned earlier, our Helena's engagement with the Africa CDC. And so we've been involved in like task forces. I'll give two specific examples. One is the task force for capacity building, which, as I said, had three components or three tracks. One is building capacity for epidemiologists in Africa, and the second one is on lab scientists, and the third one is on health informatics. So one of the things we appreciate in Africa is that health informatics is not really a recognized formal position within many government structures. So there's no career paths or career opportunities for graduates of health informatics, and people to get to other fields. So we have worked with Africa CDC to develop a framework for capacity development, including career paths for health, digital health professionals. And the good thing with Africa CDC is that it's got the legal mandate and has the support of governments that are member states of Africa Union to implement that. So it comes with the legal backing to that. So we inform policies based on best practice, global best practice, but then ride on the legal mandate of the Africa Union to deploy that and share it across African countries. And the second one is the standards for health information exchange. So where Helena's engaged with Africa CDC to develop policies and standards for health information exchange and for just to kind of standardize the way data is collected and shared, including open data architectures and use of open standards in developing systems, and even in things like data use agreements and data ownership, but more importantly addresses issues around data security and data privacy. So there's ways that Helena at a continental level is engaging through legally constituted public health agencies in Africa and using legal frameworks to reach governments. And then the next step will be moving forward to just ensure that this compliance with this. Yeah, over.
Thank you, Tom. I see, Steve, your hand is up. Would you like to add to Tom's sentiments?
Yeah, absolutely, Simon. Thanks a lot. I think from I would say from a national society, we see, specifically from the Kenya Health Informatics Association, we actually see governance as a confluence of a couple of things, and specifically one that brings cultures, practices, values and all that together. And so for that reason, besides what Thomas mentioned about, the sort of the mechanical structure of the organization, I think there's a lot of things that we've been doing and we continue doing in the background that is trying to shape and change the culture, the way people look at informatics, the way people practice informatics. And talk about the ethics of informatics. You're talking about different opinions, shared goals and values. I think besides the mechanical things that are very clear and the very clear processes and even tools of doing that, there are a couple of other softer things that you speak with people, you get people from different diverse backgrounds together and talk about responsible investment and use of certain intervention and all that. I think all that stuff is really, really, really important. And then being able to tap into the training and capacity development pipeline that is coming through from the universities, the colleges, and all that, who are training future informaticians. All that is really what, in my opinion, really underlies the value of care here, as we call it in short. So we believe that when all these things over time fall in place, then governance naturally sits on the right stilts, on the right building blocks and all that. And that's what we're hoping to do in the long run, so that even as we basically optimize and ensure that all these other processes are working well, the effective, the rules, the regulations, the policies, protection of data, and people actually putting the health consumer at the center of this all. We hope that we're able to build this correct governance structure to promote digital health. Thank you.
Thank you, Steve. Carl, I'll read this question verbatim for you. Foreign assistance has been viewed as having a double-edged effect in driving global digital development. And the same can be said of global digital health. Can you speak to the point that foreign assistance, on how foreign assistance can build rather than break or frustrate development?
Thanks, Sam. That's a fantastic question, and definitely one that can be loaded on either side. I think we need to also understand often foreign assistance and what's at the heart of it, where it's coming from and what it's targeted at. Really, so often it's looking at creating an opportunity to solve a particular challenge in the country and context that it's being served in. So to the point whether it breaks or facilitates it, there's no global answer to one that I have seen to date, but rather how it's curated and what it's looked at in country and in context is something that is of crucial importance. I think we look at how many donors have aligned to the principles of digital investment and donor alignment. There are some fantastic principles there where we're looking at the concept of collaboration and linking into the local ecosystem as well as sustainability, amongst a few other points to raise. So as we see more and more projects coming to light and opportunities, what we're trying to align to, both countries that we work in, innovators, and the opportunities we have with the investors in this space, is to ensure that we're all looking towards a better outcome of how do we keep these interventions going beyond the initial investment. What are the opportunities for sustainability, as to rather see a space that is fostering growth and development than capping it?
Thank you. Tom, would you like to add?
Yeah, sure. So I think there's two sides to it, really. First, I see the role of the foreign assistance in terms of providing the critical resources, both financial and technical. So the benefit to that. The challenge comes in with the fragmentation. So again, I want to go back to a point Alvin mentioned earlier about national e-health architecture or the enterprise. It depends on how well aligned the contribution of the foreign assistance is aligned to those national strategies. Because again, there's usually the risk of causing fragmentation where, foreign assistance is very prescriptive and sometimes it's not very well aligned to national e-health strategies. So there's ways where they actually hurt the national digital health ecosystem opposed to doing good. So there's that element of fragmentation and just means lack of alignment. But overall, I think the fact that they inject the required resources, both technical and financial, is a plus. And yeah. So yes, stop it.
Yeah, Daniela, I see you're nodding your head. Does that, square with your thoughts on the same topic?
Definitely. I would say I think foreign aid itself is like intrinsically bad. What I think is if there's an absence of stakeholder consultation and analysis to start off with, it can, start to steer in different directions where you have the local team saying one thing and an external team saying another. So what I would stress is the importance of consultation and actually speaking with local actors and also mapping who the local actors are and change agents are for whichever country or even if it's a city, wherever it is, because you can't have external persons trying to program for local needs without actually having that information. So I would stress the importance of consultation.
Thank you. Alvin, I see your hand is up. Would like to make a comment?
Yes, I think it's practically impossible for any country to do digital health all by themselves. You can't do it. You need help from other countries, from the knowledge that they created, from the devices, the tools that they have developed. The degree by which this help will come in will vary depending on how much you will need to bring in solutions. But what you cannot compromise is the governance. The country needs to own the digital health program. They need to lead the digital health program. They need to provide the vision and the strategy to the digital health program. And then you can outsource all the rest to the people who can help out. I mean, if you want to build a house, unless you're a very, very good carpenter, you will build the house all by yourself, but you don't. You hire a plumber, you hire an electrician, you hire interior designer because they can help you build a better house. But it is your house. You design it according to how you need it. The blueprint needs to be approved by you. And then you start checking whether these outsourced people are actually doing a good job. So I would always go back to governance. If you don't have good governance, everything will not work according to plan.
Thank you, Alvin. The other question is on whether local organizations or local groups are involved at the design stage of these digital health solutions programs. One of the questions we have is someone saying, in many cases, local groups are involved as an afterthought. Would you agree with that question or that sentiment, Steve?
I mean, I think maybe a couple of years ago that may have been the case, and I'm sure if you depending on who you're talking to, maybe they had very good reasons and arguments for why that was the case. I think most of it was really around capacity, but I think again going back to Alvin's comment that at the end of the day, you're the one who knows where it hurts most. So with or without capacity, you still have a voice to at a minimum express what is your pain, where are you feeling the pain and all that. I think increasingly, I've seen perspectives and perceptions around complementary roles changing and evolving in the right direction. So where this concept about I'm the expert, I know what's good for you, and I'll help solve your problems is rapidly fading away, and we're seeing I think models like human-centered design and all that taking center stage, and every opinion, every voice counting. And I think together with very, very clear governance and leadership, we're seeing a lot of really fantastic solutions coming through. So I think there's an evolution, and definitely the current pandemic, I think, is teaching us a lesson that we need each other. Thank you.
Yeah, great responses. We are getting close to the end of our session. I have this question open for all of us, or all of you. One of the questions is that digital health ecosystem is filled up with so many tools, many of which are not interoperable. And the questioner is saying probably you have a role to play in making sure that these tools are interoperable and working in concert to help the national digital health strategies for countries. Anyone of you like to take that, Tom? Yeah.
Yeah, from a local organization's perspective. So one of the things I think is important to bring people together around the table, to the key stakeholders, the key players, around a national or a regional goal, digital health, health goal, and just look at the landscape and the tools that are available to address these issues. And then, again, I want to go back to Alvin's point on governance, that there's need for a central entity that ensures, everybody is talking to each other. And I think Danielle alluded to it as well in terms of consultation. But the strong governance structures ensure that all the different disjointed pieces are brought together through open standards or some common communication channel that ensures that people are talking to each other, whether it's through open standards, through common policies that are across, and just ensuring that there's a central coordinating agency hinged around the host country or country governments that have overall ownership and leadership and guidance to these projects to ensure that the different tools are actually talking to each other, and there's some common standards through which they talk to each other. Over.
Thank you. I will now be asking you to, Dr. Alvin, did you want to say something?
Yeah, so to the point about interoperability, I don't think the people who develop the applications are accountable for the interoperability. I think it's government. Government is accountable to creating the environment for interoperability, and they can do it two ways. The first way is basically they tell everyone it's our interoperability blueprint and you have to follow it. The second way is, hey guys, come together. I'll bring all of you in one room. I'll provide the pizza and the beer, and come up and tell me an interoperability blueprint. And I will then give my imprimatur over what you agreed upon. Either way, government needs to do this. There's no way this can be done without government accountability. Thank you.
Thank you. Thank you. Now, as we come to the end, I'll ask each one of you to give a 1 minute closing thought. We'll start with Carl. Final thoughts.
Thanks. I think this has been a very powerful conversation with some amazing questions in it, ranging from architecture to interoperability to local capacity and the local teams. And it's to really that last point that I'm reminded of a situation I was in one day, talking to a urban planner for settlement areas. And their role was to propose something on a table, step back, and let the community decide what would and wouldn't work, because they knew where the water ran, where the gangs had the territory hold, what worked, what didn't. And the moment that I realized was something we needed to do as a community and to respect the local capacity is to take our pride off the table, to let the teams tear apart the design and come back with what works for the local context, because that is the gold amongst the rough that we're all looking for. So we can bring our patterns and design, and we should encourage that. But we should never forget the power of and the proper space for local capacity and ownership. And I love seeing each of the groups around the table taking that up and driving that forward step by step.
Thank you, Carl. Steve, your closing thoughts.
Thank you, Sam. I think I'd say from a perspective of the Kenya Health Informatics Association, our dream, our vision is to really continue this platform where we can continue neutrally convening useful conversations, bring everyone together with diverse or opinions. One, because we believe very strongly that that's the only way that I think we'll be able to create good solutions, but not just create good solutions, but I think create good solutions that actually help us solve real problems and that are also sustainable. In Africa, there's a famous saying that says, if you really want to go far, you have to walk with others. But if you want to go very fast, then you're probably better off running on your own. So that's what we're really hoping to do here. Digital health is a marathon. So let's work together all.
Okay, great. Danielle.
For my closing thoughts, I think I'd focus on opportunities that I see within the youth workforce development within digital health going forward. And I think it comes down to three main points. One is awareness, two, capacity building, and then three, inclusion. And not necessarily in a linear order like that, but all three working together. I think we have to raise the awareness of our young people and the entire population really of what the power of digital health is when done in the correct way. And of course, I think young persons can enter this space from many different backgrounds. You could have had a policy background, you could have had a background in health, you also could have had a background in tech. Whichever of these options, you can really come into this space and make an impact. I'm going to ask, all persons watching to really take a chance on the young people around you, the young people in your communities, ask them questions, engage them in these discussions, and give them a seat at the table to also help pilot and navigate the way forward as we try to create, universal health coverage for all.
Thank you for those comments. Tom, your final thoughts?
Yeah, thanks a lot, Sam. And thanks a lot for the privilege to share on Helena's experiences with the global audience. So my closing points will be just around the role that local organizations and regional organizations like Helena play in the policy space, and just ensuring, global best practice is brought and adopted and customized for use within the local settings in the most appropriate way. And this will likely be based on evidence. And I think Helena holds annual conferences which promote research and evaluation and sharing of best practice across African continent. And the next one is actually coming up in Uganda, in Kampala, in June next year. And we're going soon. So we invite colleagues who are working in the African setting on digital health to come and share the best practice. Those from academia who work in research and evaluations to come and share, the new evidence of what works and what doesn't work. And let's use evidence to inform digital health and use the most appropriate solutions for the different settings. Thanks a lot.
Thank you, Tom. Alvin?
Don't forget to fight complexity, compliance, and high cost. Mind the gaps. Make sure there's a governance body who is making decisions and meeting regularly. There's a shared architecture that all stakeholders can see, understand, and follow. Good management so that everyone can build their part of that blueprint and use standards for interoperability. Thank you.
Thank you, and thank you, everyone. As you can see, we just barely touched on the topic. This is a broad topic that can take the whole day, and therefore I encourage all of you participants to continue the discussion on channels that are available, including on hashtag GDHF 2020. We'll be happy to engage with you, and thank you all of you, and thank you for the panelists, Alvin, Tom, Danielle, Stephen, and Carl for your insights on this topic. And thank you, and bye for now.